The night I found Dr. Elena Marsh's coffee mug still full, gone cold on the nurse's station counter, was the same night I decided the man was made of ice. 12 hours later, I'd be the one begging him to sit down before he fell down. My name is Odalys Ferreira, 24, and I'd been a registered nurse at Brennan Memorial for exactly 6 weeks when the schedule board paired me with him for the overnight shift everybody on the floor called the graveyard special, because it always seemed to land on the worst nights of the month. I didn't know yet that this particular Tuesday would empty out half the trauma bay before sunrise. I only knew that doctor. Marsh, Elias Marsh, chief of night surgery, 38 years old, a man who apparently hadn't smiled since the previous administration, walked past me in the hallway without so much as a nod, even though I'd introduced myself twice already that week. "He does that," said Priscilla, one of the senior nurses, not even looking up from her charting. "Don't take it personal. He doesn't do personal." I did take it personal. I'm not proud of that, but I did. I'd left a hospital in another state, a whole apartment, a relationship that had quietly died somewhere around my second year of nursing school, and I'd come to Brennan Memorial hoping for a fresh start in a town where nobody knew me as the girl who got left. The last thing I needed was a surgeon treating me like furniture. By 9 o'clock that night, a 3-car collision out on the interstate sent us 5 patients in the space of 11 minutes. And by 9:20, Dr. Marsh was elbow deep in somebody's abdomen, and I was the only nurse he had left standing beside him because the other 2 had been pulled to handle the overflow. "Retractor, steady. Don't look at the clock," he said, and his voice was flat, almost bored, like he was reading a grocery list instead of holding somebody's life in his hands. I held the retractor. My arms burned. I did not look at the clock, though every cell in my body wanted to. "You're new," he said, 40 minutes in, not a question. "6 weeks," I said. "You haven't dropped anything yet. Is that a compliment?" "It's data," he said, and went back to work. And I remember thinking that if this man ever smiled at me, I might not survive it, and also thinking, immediately after, that I hated how much I wanted to find out. We lost the patient at 11:40, not because of anything either of us did wrong. The trauma had simply been too much, the kind of thing where all the skill in the world buys you extra minutes and nothing more. I'd seen death before, but I hadn't seen a surgeon stand in the scrub room afterward with his hands braced on the sink, staring at his own reflection like it owed him an explanation. "You did everything right," I said, because somebody had to say it, and I meant it. "I know," he said. "That's the part that doesn't help." I understood, then, something about him that Priscilla's warning hadn't captured. He wasn't cold. He was a man who'd built a wall so the losses wouldn't crawl in and live with him, and the wall worked exactly as well as walls like that ever work, which is to say, not very well at all, and at great cost. There was no time to sit with it. Route 9 sent us another wave near midnight. A pileup this time, 5 ambulances, and somewhere in the chaos, I found myself running alongside his gurney, calling out vitals while he barked orders that I somehow already knew how to follow, like we'd rehearsed this in another life. Maybe you've had a night like that at your own job, the kind where you stop being 2 separate people and start being one machine that happens to have 4 hands. I hadn't expected to find that with him. I hadn't expected to find it with anyone. Around 2 in the morning, in the 90 seconds of quiet between one patient and the next, he handed me a cup of coffee he'd poured without asking, and our fingers touched over the paper cup, and he said, "You're better than they told me you'd be." "Who's they?" "Everyone who talks in this hospital," he said, and for the first time, something in his face loosened. Not quite a smile, but the ancestor of one. "I don't usually say that to first years. Is that data or a compliment? Ask me when the sun comes up," he said, and went back to the next chart, and I stood there holding a coffee I hadn't asked for, feeling something shift in my chest that had nothing to do with adrenaline. By 4 in the morning, we'd lost a second patient, an elderly man whose daughter had arrived just in time to hold his hand and not 1 second sooner, and I watched Dr. Marsh walk her to the family room himself instead of delegating it to me, crouch down to her eye level, and say the kind of quiet, unhurried things that cost a person something to say at 4 in the morning after already losing 1 patient that night. That's when I stopped hating him and started being afraid of exactly how much I didn't hate him anymore. You didn't have to do that yourself, I told him later, in the empty corridor outside the AOR. Both of us slumped against opposite walls like the last two people standing after a storm. Yes, I did, he said. If I let myself hand that off, I stop being the kind of surgeon I want to be. It just costs more than people think. How much more? He looked at me for a long moment, longer than professional distance usually allows, and I felt the whole hallway narrow down to just the two of us and the hum of the vending machine down the hall. Ask me that again when we're not standing in a hospital, he said. I didn't know what to do with a sentence like that. Part of me, the part that still remembered being left, still remembered packing a life into boxes and driving to a new state alone, wanted to laugh it off, protect myself, keep the wall of my own standing exactly where it was. Another part of me, the part that had held a retractor steady for 2 hours while a man who supposedly had no personal side quietly showed me every piece of the person underneath, wanted to ask him right then and not wait for some hypothetical outside world. I think that's the question this whole night left me with. And maybe it's one you face too, in whatever version of a long, hard shift your own life has handed you. Do you let the wall stay up because it's kept you safe this far? Or do you let one person prove, hour by hour, blood and coffee and quiet corridors, that the wall was never really about you in the first place? We finished that shift as the sun came up over the parking lot. Both of us wrecked, both of us alive, in a way that felt strangely more honest than any morning I'd had in years. He walked me to my car, which he had absolutely no professional reason to do, and he didn't kiss me, and he didn't ask me anything about the sentence he'd left hanging in the hallway. He just said, "The sun's up, Nurse Ferreira." "So it is," I said. "Ask me again," he said. "The thing about the cost." So I did. He told me. It took him longer than the whole surgery had, and when he was done, I understood that some men build walls not because they're made of ice, but because somewhere behind that ice is a fire that scared them once, and the night I stopped hating Elias Marsh was the same night I found out I was standing close enough to be warmed by it if I was brave enough to stay. I stayed. I'm still not entirely sure that was the smart choice. I only know it was the true one.